the station that's on your side. This is Channel 7 News Daybreak.
6:23 is the time. Last week on Daybreak, we told you about the confirmed cases of the mumps on the University of Arkansas campus. So joining us this morning is Baptist Health's Dr. John Allen Cockrell with Sherwood Family Medical Center with what you need to know about mumps. Dr. Cockrell, thanks for coming in. This is unfortunate because it's now turned into what was just maybe a regional problem. Now it's nationwide and it's here in Arkansas.
Yes.
And I understand that you went back and looked at a little data from our state and found that this is not the first time that we've had some cases in the last few years.
I was actually surprised by that. So courtesy of the Arkansas Department of Health, right?
Yeah.
Between 2016 and 2017, 3,000 cases of confirmed mumps, nearly 3,000 cases of confirmed mumps in Arkansas, second largest outbreak in the U.S. in the past 30 years at that time. So the good news is we're not there yet, right?
Yeah.
I'm not saying that we're going to even be there yet, but mumps is a real thing. You know, it's still around. 3 confirmed cases on the Fayetteville campus, like you said. The 4th one's under investigation right now.
Yeah.
So this is something that is out there. We need to be aware of it.
Okay, so awareness is obviously a great thing to try to bring to the viewers and the public.
Sure.
How do we know what mumps?
So what are we looking for?
We look at pictures and I go, it looks like a rash. You know, what are mumps exactly? What are the signs and symptoms that parents need to keep an eye out for?
Sure. So mumps is a virus.
Okay.
So you're going to get, kind of typical viral type symptoms. So headache, fatigue, muscle pains, fever, chills, right? Things like that.
Yeah.
But unique to mumps is the swelling, right? So you can actually have testicular swelling in the neck, the parotid glands of the face, the salivary glands become very swollen, large cheeks, large neck, can have trouble swallowing too. And so long-term, issues from this can result in deafness and even encephalitis, so CNS types of infections. So this can be a serious thing, right? Again, something we need to be aware of and look out for.
So we mentioned University of Arkansas campus, college campus, but any certain group that is most at risk for something like this?
I mean, unfortunately, I feel like it's always the young, the old, and the immunocompromised.
Okay.
Right. So if you're out there in those groups, those are high risk areas. Just be aware that you're at an increased risk potentially.
All right. What does someone need to do if they feel like they've got this, or if their kid has this? A lot of people can panic if they see a lump, or something like that, or if their kid just starts getting fevered.
Yeah,
I'm sure you have a lot of people contact you. I think my kid's got the mumps. Not quite.
Well, but is it or is it not?
Yeah, right.
I mean, just go talk to your doctor.
Okay.
That's the cop-out line. But I mean, really, we want to evaluate this and take it seriously. And I know it's in the northwest part of the state.
Sure.
Hopefully, it's not going to spread any further. But it is possible that we could see cases down here too. So if you have concern, just go get it checked out.
All right. And treatment options?
Treatment options. It's a virus, so a lot of times this, self-limiting.
Okay.
Vaccines become very important though to prevent it from happening in the first place.
Yep.
If you get the 2-dose MMR, measles, mumps, rubella vaccine set, 88% effective per CDC in reducing or actually preventing the measles from actually forming in the first place.
It's a pretty good percentage.
Absolutely.
I'll take that anyway.
Yes.
Thank you so much, Dr. Cockrell, for coming in this morning explaining this. If you would like to get checked out for anything, and more resources, of course, are always available at baptist-health.com. You can call 1-888-BAPTIST. The number is on your screen.